Today is going to be an interesting show. What are we going to focus on today?
Well, actually, a lot of exciting things have been going on, from kind of accumulating around the trip that I had to Cuba and actually working with Congressman Payne out in New Jersey. I was recently notified that Congressman Payne will be working with the new House to create a PAD caucus, Peripheral Arterial Disease Caucus. And so the next few months and probably years to come, I'll be working with Congressman Payne as well as other congressmen, organizations trying to basically create new policy through Medicare and Medicaid in conjunction working with the Department of the VA, which already has this program pretty much implemented to work with all healthcare systems to help prevent diabetic foot amputations.
Awesome, awesome. So you're going to be connecting with him even more in the coming days and months.
Yes, I'll probably be, I actually just talked to his chief of staff. We're going to probably be doing conference calls initially and then maybe visiting to DC directly, having meetings and working with other local and state representatives and congressmen and senators trying to get this new policy put in place in DC, which will be a national policy. It just won't be for Ohio, it'll be for the entire United States.
That is awesome. Well, hats off to him and congratulations to you. That's just another one of the arms that you will be doing in the community.
Yeah.
You're very busy and
always.
Well, and that's a good thing. A lot of people don't understand that sometimes it's good to be busy.
Oh yes, it is good to be busy.
And it really is. And you're also doing something else. Can we share with the listeners what you're doing?
Well, I just started my MBA with the University of Dayton. I am officially a student again, doing homework and taking notes. And
what does that feel like? And how long has it been since you've done that?
I'll see. My last degree I finished in 2005. So I've been out of school, out of a classroom for 14 years.
Wow.
I haven't officially been in a classroom setting, and this is a totally different experience because it's online. So I'm not in a physical classroom.
Lots of discipline though, right?
Yeah, when we had our first class, basically the whole half of the first class was just explaining the whole setup of the program. And it's very independent, self-directed, but it's also geared to people who work, because I'm only taking one class a quarter, and I have a 7 o'clock class on Wednesday nights, 2 hours, and but most of the work we do ourselves, and then we're going to do class work, and then we'll do some group project, and then people come from all over the country to UD, and we do like a weekend group project. And actually, when I leave here, I'm going to a UD basketball game because now they have declared me UD MBA alumni.
All right.
Already. So I'm about to be a flyer. So another year or two, I'll be a flyer. So I'll have to get me some flyer outfits.
That's awesome. There's plenty of places around here.
Oh yeah, down the street. Go to the UD store, have some sweatshirts and stuff.
Well, congratulations to you, and we shall also share information about your practice, how long you've been in business, in case we're running into individuals that are traveling or going through here, or who may be listening to the show for the very first time. Let's talk a little bit about your history.
Well, I've been here 10 years. This is my 10th year of practice. I did my medical training at the Ohio College of Podiatric Medicine in Cleveland. Then I came to Dayton, did a 3-year primary care and surgical residency at the Dayton VA. And then from there, what about my second year, I started looking for a mentor and found there were none. The last African-American podiatrist had passed. He was at Charles Drew Health Center, Dr. Fletcher. And I met one of the people who worked there, actually connected me with Drew, and I worked with Fred Steed, who actually helped me get into Drew and get everything done. And then for the last 2 years of my residency, I spent starting my practice, and I finished June 2008, opened July 2008 at Drew.
That's awesome. And you've been at Drew ever since?
Ever since, 10 years.
And give us your hours.
So I'm open 8:30 We actually, Drew has now extended their hours. The building now is open, I think, to 6 o'clock every night. So we're there from 8:30 to 5:30ish every day. If you want to call, you can always call at 937-228-3668. If you are an existing patient, you can actually go online now and schedule online directly at richfeet.org, and you just click make an appointment tab. And then also we do have a lovely foot spa on site that's diabetic friendly. It's non-invasive. It does require an appointment. It is $20, and you are not required to be a patient to come to the foot spa, but you do have to call and schedule for it.
Have to be scheduled for that. And speaking of what you talked about a few moments ago, Dr. Richmond, why do you think, and especially with your experience in traveling to Cuba here recently in October, why do you think that podiatrists are so few and far between?
Well, it's a subspecialty in itself. We're a micro specialty, I guess you could say. And dealing with the feet is not a very, I guess, exciting profession. It's not something a kid would wake up and say, I want to be a foot doctor.
Well, share with us, why did you choose to be a foot doctor?
Well, my mother's a nurse, and
but why the feet?
She's the one that told me. She's like, from working at, my mother's been a nurse now. See, I'm 44, so she's been a nurse 45 years. So she when I first said I wanted to be a doctor, she's like, well, what about a foot doctor? And I was like, well, what do they do? And she said, oh, they come in, they take care of people's feet in the hospital, and all the foot doctors are happy, and they're not stressed out like all the other docs. They don't take call and all that stuff. So I researched it. I actually met with 2 African-American podiatrists in Louisiana before I left. And the female said, she could work around her life schedule. And then the male, he, said he had a good quality of life, a good income, and they both enjoyed, their professions. And, I don't regret becoming a podiatrist. I think it was, as people say, order your steps. My steps were already planned because I became a diabetic in medical school. So having the disease that most of my patients have, it made me, it's severely, empathetic to everything they deal with. We're on the same, we have the same aura. We can subliminally talk to each other because we go, with my patients, we all go through the same things. And lots of times I'll say, we, and they're like, we. I'm like, yes, we.
I'm part of that.
Yes, I'm on insulin now, and it's just a continuum of being a diabetic, and a lot of patients, there's a lot of misinformation out there, especially when it comes to diabetes and any disease state, really. And with the advances of Dr. Google, patients think they can diagnose and treat by Googling or Wikipediaing or just going online. They can say, oh, okay, I got gout because my foot's red hot and swollen. But then when they show up at the office, you're like, no, you have cellulitis. You need IV antibiotics, and you might need to be admitted to the hospital, but you've been drinking cherry juice because you read an article that said to treat gout with cherry juice, but you're systemically sick. You're going septic. So now you need to go to the ER. But unless they come to a physician or have someone in their family that's a physician, but still, that person's still going to tell them you need to be physically seen and evaluated by a physician or a nurse practitioner to truly determine what's wrong with you and then address it.
Tell us a little bit, Dr. Richmond, about how you came up with that name. Richmond Foot and Ankle Clinic, and we know that your last name.
That's pretty much
anything
no.
else behind that?
No, it's my last name, but since I'm not from here, I was not aware there was a Richmond, Indiana, only I think 30 miles from here. So actually, I get mail from the other Richmond Foot and Ankle Clinic.
So there is a Richmond Foot
yes,
and
in
Ankle Clinic
Richmond, Indiana, and a lot of people are like, "Oh, you're in Richmond." I'm like, "No, my last name's Richmond," but not being from here, I didn't know that there was a Richmond, Indiana that close to Dayton. So it's just my last name.
Got you. And so at Richmond Foot and Ankle Clinic, you take all insurances?
Pretty much all insurances except for some forms of Anthem. We also are on some of the newer Medicaids, the Paramounts, UHC, Amerigroup. we're on pretty much every other plan besides some of the anthems, and I think some Cignas. But if you're worried or concerned, the best bet is to call my staff. They have it all listed at 937-228-3668.
Also, Dr. Richmond, we want to mention too, you're on Facebook Live right now, correct?
Yes, I'm on Facebook Live.
And your name?
I think it's under, if you go to Richmond Foot and Ankle Clinic, or under my general name, Tanisha Richmond.
Which is spelled?
TANISHA RICHMOND. I'm still learning this stuff. I need a social media master's too.
Somebody help Dr. Richmond out.
Yes, I need a little social media master.
And so when your patients, for new patients that come to you, what are some of their first few questions that they ask you?
Well, it just depends on why they're coming.
Yes.
It's a lot of fear out there when it comes to feet for some reason. A lot of fear, a lot of shame. And, when you come to a specialist, I've had patients who come to me and don't want to take off their shoes.
Like, I come here to see you about my feet, but can you just work on them?
Well, yes, and I'm like, I don't have x-ray vision. And, or they're really ashamed. I didn't get a pedicure. Well, I want to see your feet in your natural state. I want to see how they look every day. I don't want to see them beautified, because I want to see what they always look like, so I can treat whatever issue you have. Mm-hmm. And I think a lot of questions is, well, I tried this doc, I tried that doc, and nothing works. Well, you're trying over-the-counter stuff, or you're trying home remedies, or Dr. Google, or YouTube, or whatever, Pinterest. These different places, you're just grabbing information and trying different things, but you haven't tried prescription medications or a true treatment plan. Like, I had a gentleman who had heel pain, and he had tried different things, but he hadn't tried custom orthotics, which is what we have in our office, or specifically podiatry prescribed orthotics, or physical therapy, or injections. So, when you come to my office, we're going to work you up. We're going to talk about what your problem is. We're going to talk about your treatment options. And as a patient, I'm going to offer you what are your treatment options, and most of the time let you make that decision. Now, if you're, say, come in with gangrene, or you're septic, or you have a foot ulcer that's infected, you don't get to make that option. You're instructed, which ER do you want to go to, and I'll call and let them know you're coming. Because at that point, if you don't follow up on this, you could die. You could go septic, which means the infection gets in your bloodstream and kills you. So, but in most cases, it's not that severe. It's just, okay, we're going to try this, this, and this. We're going to work through this. There's no magic wands in medicine. Mm-hmm. And a lot of patients want magic wands, but they don't exist.
And what's amazing, a lot of times when you go to a specialty doctor like you are, you have to have a referral from your medical doctor, but with you, they don't.
Well, it just depends on the plans.
Okay.
That's like 3 plans. I'm thinking like Cigna. I'm thinking some UHC plans are requiring referrals. And of course, we've just started a new year, so there may be new rules. Each year, new rules tend to drop. Mm-hmm. So if you're concerned about referrals, but the first thing is always just to call the office at 937-228-3668, talk to the front desk, give them your information, and they can tell you on your plan whether you require a referral.
Which is a good starting point, because some people may say, you know what, I don't really have any real issues.
Yes.
But I would like for you to look at them, so if I have something, you see something I need to work on,
yes,
I can start doing that.
Yeah, I mean, and that's the whole thing about visiting Cuba. The whole thing that we're trying to implement with the PAT caucus is actually following an actual process that already exists in the VA system of preventative care, where they actually risk stratify patients based on their healthcare risks. So patients who are diabetic are put in a certain category and monitored. If you're in renal failure, you're monitored. If you're a smoker, you're monitored. So you're monitored in a continuum, so you don't walk in one day with gangrene, because you've already been tested. If you have blockages or things in your legs or vessels, that's already been addressed. And then if something does happen, you're already under the care of a physician. It's not something that has to start. It's just contacting that physician. And that's what I try to do in my practice. That's the way my practice is set up. If you're a high-risk patient, you're going to get an initial screening and be seen by a vascular specialist and be under his care as well as my care. So if something happens or if they see something, they can fix it before it's too late.
Okay, that's awesome. And for those of you that are just tuning in, you're listening to Footsteps for Life, held here on the 4th Saturday of the month with our local podiatrist and foot specialist, Dr. Tanisha Richmond from Richmond Foot and Ankle Clinic, located at 1323 West Dr. Martin Luther King Jr. Way, inside of the Dr. Charles R. Drew Health Center. Dr. Richmond, I refer to it as a store, but in your practice, you have orthotics and other sorts of gear, as I put it, in products, and it's really great. For the feet, can you share some of the things that you have in there?
Well, we have diabetic socks, we have compression socks, we have antifungal toenail polish that's colored so you can paint your nails and make them pretty and treat your fungus at the same time. We have different kind of pads for your hammer toes, your bunions, your corns, your calluses. See what else we have? Creams, ointments. We have natural pain reliever creams that you can use instead of, especially with the opioid epidemic, more and more, or pretty much all physicians are trying to stay away from pain meds when it comes to pain in general, using more topical and other modalities that don't have narcotics in them. So we have a lot to offer. And then, of course, we have the foot spa, which is cash. That's $20. We also have a 3 for $30 special. You can buy 3 of them up front for $30. And we're also on Groupon as well for the foot spa. And a lot of patients, as far as the foot spa, will schedule the spa right before they come to see us. So they'll get the foot spa, and then when they're done, one of the docs will come in and treat the patient.
That's awesome. That's awesome. And it's good to know that you have all of these things, so if it's something that they need, even, before they see you, they can come and get it.
You don't have to be a patient to come to the foot store. Just come by, and if you have specific questions, then you may need to have an appointment, because if you're wanting to talk to someone about which hammer toe pad you need, my MAs are not trained enough to know specifically. But if you're an existing patient, you can say, well, I bought this last time, or I want to buy the polish or whatever, the lotions or stuff like that.
And Dr. Richmond, this is funny in a sense, but while we're talking about hammer toes, can you share and help our listeners understand where that name came from, and tell them that it's not relative to MC Hammer?
Well, he might have hammer toes from all that.
They didn't get the name from him, though.
No. Hammer toes, I'm sure, was way before even MC Hammer existed. It's just a term. I think the medical term is a contracted digit. So basically what happens is the toes contract. They're not straight anymore, and they kind of scrunch up in your shoes, and when that happens, you get bony prominences. So that's how you get your calluses, your corns, because that toe is scrunched up, so the bones are rubbing in your shoes. And then, of course, hammer toes are caused mostly by genetics and then also outside factors. So like on a boomerang, you see a woman that wears a lot of high heel shoes, a lot of pretty shoes, most times she'll have hammer toes and bunions, because her feet are wide, but she's putting her foot into a tight, narrow space. And over time, our bones and soft tissue will mold to whatever it's in. So that's why you'll see, I've seen it online where they have celebrity feet. But I might be a foot podiatry thing, but I'll sit there and her feet are jacked up. But that's because she always wears these pretty shoes that were designed for a small, narrow foot, and they got a wide, flat foot, and they're squishing it in there. And, over time, it can become a problem, especially if you're becoming like diabetic and you don't feel pain. A normal person would take the shoe off, look, and say, okay, I need to do something. But if you're diabetic and you don't feel pain, you would just walk through that. And that's how you get the sores and other problems.
And, we'll kind of go through a few questions that are coming through from some of our listeners that may be a little shy to get on the radio. But we want to let them know that you are taking calls now at 457-1210. So if you have any questions at all, or comments that you would like to make or you would like to share or talk with Dr. Richmond about, you're welcome to call live and at 937-457-1210. So you were just talking about the hammer toes and is there a such thing as someone having a foot fetish, and have you done any research on that? No,
but from my Instagram page, I've had to delete a lot of foot fetish people who followed me. and now these feet kept popping up on my page in different ways.
Wow.
Yeah, there's a lot of people with foot fetishes. I don't have one.
Let's make that clear.
I don't have. I like healthy feet. But I don't. It doesn't excite me in that way. It excites me because I know those feet are healthy. But yes, it does exist. I mean, we have people who have fetishes on every level. Like I think it was a couple years ago, they had a fire at the furry festival where people like to dress up like furry animals. So it is what it is. But no, I'm not into feet on that level.
And let's also, we talked a little bit about earlier, things that maybe could be genetic. Are there particular foot problems that we can pass down to our children? Can you share some of those?
Yeah, well, of course, flat feet, bunions, hammer toes, varicose veins, sometimes there's something called tarsal coalition. So that's where the bones of the foot fuse in utero. So they're fused when the baby is born. Syndactyly, and that's where sometimes the toes are fused. There's actually a tribe in Africa where I think most of the people in that particular tribe only have like 6 toes. And also that's probably due to inbreeding as well. So they're not spreading their genes out. They're not going outside of that tribe to spread their genes to get a more diverse genetic pool, I guess you could say. So most of the people in that tribe all have syndactyly. So their toes are born fused or they're born missing toes, and sometimes fingers as well. So, and then of course the diabetes you can pass, sickle cell trait you can pass, some other genetic problems. There's a lot of, mostly when you're talking about genetics, genetic diseases can be passed on to children. But of course, in African Americans, our #1 trait would be sickle cell trait. Okay. And of course, I think all African Americans are checked at birth. And then, of course, when they're about to have children, they check them and have a conversation with the parents about the chances that your child could either have the trait or full-blown sickle cell disease.
Okay, so when we talk about athletes' feet and that odor and things like that, how can one catch that?
Well, you can catch athlete's foot pretty much by walking barefoot.
Is it pretty much a fungus?
Yeah, it is a fungus. Mm-hmm. It's a fungus that prefers to live on the foot and also likes to live in your toenails. So it can affect either thing. So most people who have athlete's foot chronically or a long time usually have toenail fungus as well, which is the thick, crumbly yellow nails. Athlete's foot is generally caught most of the time by people going to the gym, walking barefoot in the gym, prisoners. I take care of a lot of ex-cons, just coming out of vacation, go on their way to vacation. Mm-hmm. And they develop athlete's foot in prison. And it's just because it's you're using 1 to 2 showers or maybe 3 to 4 showers for hundreds of people. So if one person has athlete's foot, it's just going to pass, to the next person. Mm-hmm. And then, of course, if you're in a dormitory where you're sharing showers, gyms, if you're in PE, you don't want to be walking around barefoot. If you're going to the pool, you don't want to walk around barefoot. And of course, you always increase your chances as well of getting warts, walking around barefoot as well. So you have those kind of problems. And then also, I don't know if we ever talked about MRSA, which is methicillin-resistant Staph aureus. That's more of a skin-to-skin contact. So you see more of that like in wrestlers because they're having skin-to-skin contact and spreading infections like that.
Okay. Dr. Richmond, when you end your show, you always say, take care of your feet. You only have 2.
Yes.
So there's a couple of questions coming in. A lady says, I'm in my 30s and I cannot bear being in heels for more than 30 minutes, but I have a 50-year-old cousin who can wear hers all day. Why is there a difference?
It's just your genes and your genetics, and maybe her pain tolerance.
She might be in pain and might not be.
Yes, I remember when I was in high school, we had a lady that would go to my church. I think she was in her 70s, and she was still rocking like 3 to 4 inch heels.
I had a great aunt in her 90s.
Yes,
I tell you, Aunt Lucille was something else, and I felt really embarrassed. I'm in my 30s at the time, and I'm thinking, oh my God, I'm embarrassed. My 90-something-year-old great aunt is jazzy too.
Yeah, but I mean, she valued wearing those heels. I mean, I'm in my 40s. I haven't worn a heel probably since college, and I probably will never wear a heel or a narrow heel again. I have shoes that have a nice
like wedge.
Yeah, well, I don't even do wedges because wedges to me are too unstable. Because you're on I like more of a 3-inch heel, a thick heel, because it gives you more stability. So when I walk, or the way we were trained, when you're walking on an unstable surface, you want something that you can balance on. So if you're walking, say, down one of these local streets and the concrete's irregular, if you're in a wedge, you hit a dip or something, you're going to fall over. But if you're in something more stable, with like a thick heel, you're less likely to fall. But, I mean, as you get older, you think things differently. Before, you wanted to be cute and sexy. Now you don't want to break a hip. So you think differently, and you look at shoes differently. Because, you know, when I see a pair of shoes or I see someone in these shoes at church, I just look at them and say, oh, I should give her my card. She gonna need me.
So just in case.
Yes, in case you sprain your ankle or develop some bunions, hammer-toes, corns, calluses, blisters, whatever, pain from wearing those shoes, because they're not designed for the way we walk. It's not designed for the way we ambulate every single day. It was designed by some man, I'm assuming, originally designed high heel shoes for their pleasure, but not thinking of the woman. The pain it causes the woman to wear these shoes.
And there's always a cliche out there that says, when my feet hurt, I hurt all over.
Yes, you do. Actually, it goes up. It's just like a house. If the foundation isn't stable, you'll start to see cracks in the ceiling. Things start to slant. And the same thing with the human body. If you're off balance at your foot, the pain can radiate all the way up to your teeth. You know, or giving you headaches because you're off balance.
So how many bones are there in a foot?
I think it's the 26 bones in the foot.
26, that's a lot of bones.
Yeah, they're very small bones.
Okay.
But
so can they be injured easy?
I wouldn't say easily. It's different ways you can injure them. After learning about all the different bones and treating over the years, pretty much, like if you're a runner and you sprain your ankles, you're usually going to break your fifth metatarsal, or if you break your ankle, you're going to break certain bones in the ankle joint. Certain injuries will predispose you to break certain parts of your foot, but there's no way to say, okay, you step this way, you're going to break this guaranteed. It's just the force. It's just the amount of force that hits that particular bone that's strong enough to make it crack. And then it also has a factor of the age of the patient and the health of the patient. So that's why I went back to saying, like, as you get older, you're not going to wear these high heel shoes, because if you fall, you're worried more about breaking your hip or something versus in your 20s. If you fall, you're all right. You just get back up and go on about your business. But you fall in your 50s and 60s, you're worried about, oh, I might break a hip, break this, break that, because we start to lose our bone density. So it just depends on a lot of different factors. But the older you are, the more likely you are to break things.
Okay, we have apparently a parent that has an athlete, and I guess he experiences quite a bit of shin splints. So how does he or she, I don't know if it's a male or female, prevent that?
Probably need some orthotics in their shoes. They need to come in. We need to watch them walk and see exactly what their problem is. And then there's different orthotics that I carry in my office that can address the specific problem. But most likely he just needs some more support in his shoes to control the motion of his foot. So the orthotics purpose is to control motion, which then controls other problems. But if you're having something, it's something out of whack. But as podiatrists, we can figure it out.
Okay. And we talked very little about bunions. And can you go more into detail about that, about the bunions?
So a bunion is, so everyone has a first ray, which is your big toe. So when the bunion happens, the bones in that toe start to shift over, and then that joint sticks out. And that's what you see is that big lump on the side of your foot is actual bone sticking out. So the way to fix that is surgery. I see little things on the internet. They do not work. The only way they may work would be in a child. But then you also want to be careful because you would do what's called overcorrect a child. So you still want to bring in a child who's developing a bunion. But for a surgical way to treat that is actually the patient has to be put to sleep. We actually have to make cuts into the bone, move things around, put in screws, and make that bone straight again. And for people who do not want to go through all that, I generally just tell them, get you some soft shoes and stay away from leather. So you want to get a soft shoe that's made, more of fabric, and stay away from leather because leather doesn't give. So leather will just continue to rub that bunion and irritate it. And of course, stay away from high heel shoes.
Gotcha.
Because they're too narrow for bunions.
Okay. And tell us a little bit about a stress fracture.
So stress fractures are generally they're usually called march fractures. So most people who get stress fractures are in the military. So they'll have to march for miles and miles and miles. And that repetitive force, say on a fifth ray or one of the bones of your foot over time causes a fracture. Or runners get stress fractures, usually long distance runners, because you have to think about every time they hit that ground, the force on that bone. And it's a chronic repetitive thing. So it's not like you would walk out, slip on a piece of ice. That's an acute fracture. That's instant. A stress fracture may happen over months, may happen over a year, but it's from a runner that runs and they're just hitting that ground and that piece of bone is slowly breaking.
Speaking of runners, for those that run like daily, there are some people that do that daily in preparation just for normal exercise or preparation for a marathon. So when should they change out their running shoes?
It depends on how active they are, and then also just checking the shoes themselves. If they're worn, especially if they're wearing more on one side than the other, you want to start changing them out because that's going to make you more unstable, and that can lead to things like shin splints, ankle sprains, because basically your foundation is off.
Okay.
So most of the time, runners usually replace their shoes about every 3 to 6 months. A non-athletic person probably could keep their shoes for years or at least once a year, but it's more the wear of the shoe. You want to look at the bottom, you want to look at the sole. Is it worn? Are there holes, or is it wearing out more on one side than the other? Then it's time to get a new pair. And then if it is wearing like one side more than the other, that's probably a sign you need some orthotics to balance out your foot in that shoe. And then of course, if it's causing you pain, you want to always just stop and look and check and investigate.
And speaking of stopping and looking and investigating, there's something that everyone can do as a free evaluation on Thursdays, correct?
Yes. Now we have PAD free screenings on Thursdays. You can call the office at 937-228-3668. And you come in, you'll meet with one of the techs. We'll go through some questions with you. And one of the docs in the office will do a quick exam with you and check you out. If you qualify, then we can do actual vascular testing on site or get you scheduled in to get that done. But of course, if you have cramping in your legs when you walk or sleep, your feet are cold, you don't have any hair on your feet or legs, your skin is dry, your skin is turning colors. If you are caramel on top and you are black on the bottom, that is a problem. If you are white on top and hot pink on the bottom, that is a problem. If you're having a lot of discoloration, if your nails are real thick. And of course, if you are a smoker, especially if you've been smoking over 10 years or longer, and if you're diabetic, and if you're also on dialysis, is something, all three disease states will increase your chances of having poor blood flow.
Okay, awesome. Great information, Dr. Richmond. And of course, we'll take your calls at 937-457-1210. And I believe we've got a caller on the line. Good afternoon, caller. How are you?
I'm fine, thank you.
Good.
Good afternoon.
Your first name and question or comment, please.
Yeah, my first name is Bob. I just have a quick question. I usually walk about on treadmill about 20 miles a week. I do about 4 miles per day. And I'm wondering how long should my sneaker last. I have 5 pairs, so I wear a pair each day. And just wondering about that usage on that. I was told I was very high usage.
Yeah, probably want to replace them about every 3 to 6 months, but you just want to start looking at the soles of your shoes and see if they're excessively worn and if they are wearing on one side versus the other. So you just want to just start looking at the bottoms and seeing how they feel, and do you feel stable in your shoes? Because if you're losing like your grip and your tread, of course you want to replace them so you don't slide off that treadmill. Yeah, but still you'll probably wear them down. So just looking at the bottom of the shoe and looking to see if it's still got a good tread on the shoe and it's not wearing or getting holes or anything in the bottom of your shoes.
Okay. Well, the interior of the shoe, does that?
Yes, that would affect you as well, especially if your insert is worn out. You know, you can start to get pressure points where that insert's worn out, like calluses and corns or even blisters, depending on how the shoe fits on your foot.
Okay, well, thank you so much.
All right.
Thank you, Bob. Have a great day. You're listening to Footsteps for Life here on WDAO. Dr. Richmond, our local podiatrist, is here for Saturday of the month. Get your questions in now while you can. We have an open line for you at 937-457-1210. Good afternoon, caller. Your first name, please?
Liz.
Did you say Mary?
Liz.
Oh, hello, Liz.
Hello.
How are you? Did you have a question?
Well, what I know I'm flat.
Uh-huh.
But lately, I've been having, like, burning under the bottom of my feet, like, it's cramped, like.
Mm-hmm. Are you diabetic?
No,
Smoker?
no.
No. I mean, it could be a lot of different reasons why you're having, because you're describing two different things. You're describing neuropathy, which is tingling, and then you're describing cramping, which could be dealing with blood flow, or it could be dealing with some loss of metabolites. So really, to figure out why you're having that, you would need to come in. You could always call the office and schedule an appointment at 937-228. Oh, okay. You ready? 937-228-3668. And then we could go through your whole medical history and medications and also do some testing to figure out where that those sensations are coming from. 937-228-3668. Thank you.
Thank you, Liz. Have a good day. We have an open line for you at 457-1210. And Dr. Richmond, I think we'll take a quick break here. Some good questions. I want to thank Bob for calling in with his questions about his sneakers and running. And, of course, he's got several that he ships to, which is good.
Yes.
That he's got more than one pair. And, of course, Liz, she's got that burning under her feet. She needs to see you.
Yes.
Liz, if you missed that number again, we want to give it to you, 937-228-3668. You're listening to Footsteps for Life here on AM 1210 WDAO and FM 102.3. We're going to take a short break. We'll be back in just a moment.
Hello.